I'm happy to introduce Don Levinson of the Maternal Child Health Bureau Division of Healthy Start, and to talk about how Healthy Start fits into the division's behavioral health activities. It's been terrific working with Don, so let's welcome her. Don, hand it off to you.
Good afternoon, everybody. This is Don Levinson. I am your behavioral health lead in the Division of Healthy Start and Perinatal Services. And before I get started, I wanted to let you guys know I'm a policy social worker. I'm also a certified mental health first aid instructor, thanks to MCHB's support for that training. And I hope there are other mental health first aid instructors out there among the Healthy Start community, and that many of you might have had the opportunity to take that training to become a mental health first aider yourself. And I'll mention that again at the end of my brief comments here. In my brief time with you this morning, I want to highlight a few of our behavioral health programs in the Division of Healthy Start and Perinatal Services. I want to remind us why behavioral health matters now more than ever, and offer you some concrete resources that you can use in your work to support the mental health and well-being of women and families, and to help prevent alcohol and other substance-exposed pregnancies. Could we get the next slide, please? One more. There we go. Perfect. Thank you. So I want to frame the division's behavioral health work in the context of how the Maternal and Child Health Bureau addresses behavioral health. So we acknowledge there is no health without mental health, and MCHB's programs fundamentally promote the mental health and well-being for maternal and child populations across the lifespan. This aligns with our mission to improve the health of America's mothers, children, and families. MCHB focuses our efforts at multiple levels. At the systems level, our programs reach national, state, and local stakeholders. At the provider level, some of our programs, like Healthy Start, deliver direct services. Some train students or practicing healthcare providers, and others provide clinical guidelines and quality improvement efforts for the field. And then, of course, we have the policy and innovation level. But in a nutshell, what I like to say is MCHB does the following 8 things along the public health continuum to support mental health and well-being, which you can kind of see on the slide. We promote, prevent, screen, intervene, refer, treat, train, and support. And in Healthy Start, you actually do a lot of those things. So more to come on that. Next slide, please. So why behavioral health matters? Reflecting on our current environment in the wake of the pandemic, where so many have lost jobs and homes and loved ones, and the impacts of racism on the lives, health, and well-being of African Americans and other people of color has been laid bare, it's no wonder that the social isolation and uncertainty of if and when life will ever return to normal has sent rates of anxiety and depression skyrocketing. More people, young and old, in their desperation without proper help or lifelines, are taking their own lives. And more people are increasing their use of alcohol and other drugs to self-medicate the pain and the weight of our current reality. Well, on this slide, you can see the statistics here on this slide. I'm not going to read all of them, but take note, those are all pre-COVID data, okay? And so now, we're seeing more. We're seeing more of these mental health issues. Women, I'll just highlight a few things. Women are more at risk for mental health conditions than men, with anxiety and depression being the most common. Women with a substance use problem are often using drugs or alcohol to cope with the pain of trauma or other adverse childhood experiences. And mental illness and substance use are often co-occurring in women, and they influence each other bidirectionally. But there is no single cause of mental illness. Rather, it's the interaction of biological, ecological, and social factors like brain chemistry and genetics, adverse childhood experiences like trauma, or growing up in a home with someone with an untreated mental or substance use disorder. Poverty, racism, other systemic barriers, all of these factors contribute to our mental health and well-being and how we're able to cope with experiences of adversity. Before I move on to the next slide, and because I have this platform today, I also wanted to share with you a mental health related film recommendation with you. It's called Sis, You Okay? It's an intense social documentary that shows conversations among African American women discussing their experiences with trauma and mental health. It's just 40 minutes long, and you can actually view it on Amazon Prime Video. So this is a mainstream available film. You should know that before you watch it, the film can be triggering for some, but Sis, You Okay? Is ultimately a message about hope and healing for African American women. So next slide, please. Bear with me. Okay. So this slide shows a snapshot of the other programs in the Division of Healthy Start and Perinatal Services that focus on women's behavioral health. They fall into the 4 buckets that you see here in red: healthcare provider training and telepsychiatric consultation, healthcare provider training, quality improvement and guidelines, and service delivery and workforce development. The first program you see listed is called the Screening and Treatment for Maternal Depression and Related Behavioral Disorders Program, or MDRBD for short, another acronym from your federal government. This program supports behavioral health integration in primary care and maternal health care in states through new and expanding telehealth access programs. These 7 states have developed programs to provide real-time clinical behavioral health consultation, so doc-to-doc consultation, care coordination support and training to expand frontline providers' capacity to screen, assess, treat, and refer perinatal patients with depression, anxiety, or substance misuse. I've got more slides coming up for you on this program to share why it's a resource for you. The next program listed is brand new, and it hasn't been awarded yet. It's called Supporting Fetal Alcohol Spectrum Disorders, or FASD, Screening and Intervention Program. This provider training has a 2-pronged purpose. The successful awardee will provide training and technical assistance to cohorts of maternity care providers to help reduce alcohol use in pregnant women, and also to cohorts of pediatric providers to improve developmental outcomes for children and adolescents with a suspected or diagnosed FASD in states, tribes, territories, or communities that have high rates of binge drinking among pregnant women, and especially in rural areas. The next 2 programs on the slide are under quality improvement and guidelines. You may already be familiar with these programs, AIM and the Women's Preventative Services Initiative. But of course, my slice is behavioral health, so I wanted to flag a few specific components. AIM is the Alliance for Innovation on Maternal Health. AIM works through state teams and health systems to align national, state, and hospital-level engagement efforts to reduce maternal deaths and severe maternal morbidity. So among the maternal safety bundles, or sets of evidence-based practices that AIM helps hospitals to implement, one of these bundles is focused on the obstetric management of women with opioid dependence. And in a later slide, I've included a link to this resource. The next item, the Women's Preventative Services Initiative, is a national coalition of health professional organizations and patient representatives. And they develop, review, update, and disseminate clinical recommendations for women's preventative health care in the U.S. So again, why is this on my slide with the behavioral health? So just 2 weeks ago, WIPSI, the Women's Preventative Services Initiative, released a new recommendation to screen for anxiety in women and adolescent girls 13 years or older, including pregnant and postpartum women. Because HRSA adopted this recommendation, it will be incorporated into the summary of covered benefits for preventative services without cost sharing. so no cost to the women, and that's required by the Patient Protection and Affordable Care Act. This is the first such recommendation for universal screening for anxiety. So I definitely wanted to flag that news for you. And the last bucket, that's you, that's Healthy Start. That's under service delivery and workforce development. So in relation to addressing depression and substance misuse, Healthy Start programs use standardized evidence-based approaches to screen, intervene, and refer perinatal women and parents of young children to behavioral health treatment and wraparound services. Healthy Start endeavors to provide trauma-informed care and health education to support the mental health and well-being of moms, dads, and families. In fact, I also wanted to mention, regarding trauma-informed care, 14 Healthy Start grantees opted into a virtual 7-month community of practice on trauma-informed care. And I imagine at a future grantee meeting, you'll hear from your colleagues on their experiences. So next slide, please. I noticed that I don't have a lot of time here. Okay, so we're going to do this. Excuse me. So I've given you an overview of the division's behavioral health program. But what I really hope that you take away from the session, with the number of slides that you'll be able to download later, is how you can leverage these programs and resources for use in your program. I want to summarize the next several slides in case I can't get to them all. It's popping up on my screen. Just a moment. Okay. So I want to make sure that that you're aware that MCHB funds 2 telepsychiatric consultation programs that are now operational, one for maternity care and one for pediatrics, and how to contact them in your state. I want to mention some great resources that you can find on Healthy Start. That you can find on Healthy Start TA Epic Center website. We have 2 brochures on. We have 2 brochures on depression and anxiety during and after pregnancy, one for moms and one for dads. And we have great materials for Healthy Start workers to learn more about preventing substance use during pregnancy. So if you can flip to the next slide, please. So again, in the interest of time, I just want to say here that the next several slides show our telepsychiatric consultation line program. Could you flip to the next slide, please? Yeah, this is an example of how providers can contact the teleconsultation line. And flip to the next slide, please. This slide shows you, it lists all of the operational telepsychiatric lines for perinatal health care. And this is from the Lifeline for Moms website. Those are all of the active programs that they're aware of in the country, and they run a national network of these programs. And you'll notice that the states with asterisks are HRSA funded. And so again, why did I want to share this programmatic slide with you? Because for those of you who are clinicians treating women or your behavioral health providers, you know, this is a line that you can call to help manage care for your patients. So flip to the next slide, please. This is the Pediatric Mental Health Care Access Program. It's our sister program. It does the same thing as the perinatal program, but it's for pediatrics. And again, I'm sharing this with you today so that you can share this information with your CANs, with your other community partners, and with other healthcare providers in your community. These resources are there for the clinicians. Flip to the next slide, please. This is the slide showing the depression brochures that you can download for your clients. And you'll notice that there's also the revised depression booklet that some of you may have been familiar with, and that one is available in Spanish. And skip to the next slide, please. Maybe one back. Did we miss a slide? One more slide. Keep going forward, please. Okay. All right. You know what? We seem to be missing a slide, but that's okay. I will make sure that you've got the updated slide deck. And the rest of the slides show a number of other resources, including the ones that are on the Healthy Start website around alcohol and substance-exposed pregnancy initiatives. I just wanted to mention that there are several tools on that site that you can use for your teamwork. Some great staff development resources for groups. And then there's a number of other resources. Unfortunately, I'm not going to be able to mention. As I wrap up, I just want to say again, my name is Dawn Levinson. I am your behavioral health lead. I work closely with the TA Center to make sure that you all have what you need to address the mental health and behavioral health needs of the women and families you serve. Thank you so much.